I've got a great title. It is somewhat of a misnomer, but really, it's a recognition that for HCA, as part of an overarching arc over the last 2 or 3 years, that we need to make the transition from being simply a hospital company to a healthcare company. With that said, we know where our core is. We're not going to be, Intermountain Health. We don't want to be Geisinger. We know what we do well, and we're going to do really well with that. But we are evolving. As you said, it's been a crazy couple of years, certainly in the innovation space. And it's allowed us to think through not only how do you get through the last 3 years and continue to get through what was the last 3 years, but what does the future look like? And that optic of what the future looks like has completely changed through the lens of a post-pandemic environment. Hopefully we can say a post-pandemic environment. But my job, simply, great title, fancy title, but here's what it reduces down to is I'm the only physician within payer contracting alignment, which is an unusual feature. And my job is to help HCA think through how do we turn our relationships with payers from what is a transactional periodic event, contracting cycles, to something more transformative, that's something that looks at alignment, integration, so that when it comes down to doing those contracting events, the totality of our relationship is appreciated. But quite frankly, it is the recognition that payers are our lifeblood, and we need to partner with them. And quite frankly, we have a lot of alignment. We want the same things in general. We struggle as large organizations to prioritize those and to partner. So first and foremost, to partner with our payers directly, indirectly, if you would, through thinking through their client base, the employers, and how can we appeal to them and create solutions that these payers can deploy. But it's really four things. My job is to go out and proselytize the value that we have. It's to take their perspective internally, and I like to use alliteration, as we start to continue to build solutions and not just service lines. It's to partner with the best and brightest as we do build those solutions. We don't have all the parts and pieces, whether it's a technology, a platform, a device, a service. Who do you partner with? How do you partner with them? And then how do you deploy that through a large footprint like HCA? And then finally, the connection to contracting is if you can do 1 through 3 pretty effectively, how do you monetize that value? So it's an interesting role. It is 4 or 5 different roles, all in an amalgam together. But I think at its core, it is the essence of innovation, which is simply how do you do what you do well and do it differently and adapt it.